This is Public Voice. I'm Scott Feschuk, and I'm with Mark Stabile from the School of Public Policy and Governance at the University of Toronto. Mark, it's been a long time since we've had a good old-fashioned brawl over public healthcare funding, but that doesn't change the reality of an aging and growing population putting stress on the system. To what extent, in your mind, is our healthcare system sustainable?
Well, I think we've been spared a few years because people have been focusing on the environment, but I think we have a good healthcare system, but the problems in it remain. And let me just quickly tell you what I think the big problem is. The big problem is for the last 30 years, every year healthcare spending has grown faster than our revenues or our economy has grown. So not that much faster, but a little bit faster. And over time, that means that in order to pay for our public system, we need to keep finding money, or governments keep needing to find money from other things that they fund. That could be education, that could be social assistance, or they have to raise taxes. In order to do that, they haven't been raising taxes, they've been lowering taxes, and so in order to keep the healthcare system going, they've been taking money from other places in government. And that's probably not sustainable. Couple that with the fact that we're not actually covering everybody for everything, don't have access to prescription drugs for a lot of people, and I think we have a sustainability problem. I would say one thing, which is there's a large group of people out there who think that we can solve this problem if we just spend smarter. And I think it's really important to try and spend our healthcare money smarter. And we'll probably find some savings there. I don't think that's going to solve the whole problem. And let me tell you why. Because our problem is not ours alone. If you look across the developed world, everybody's in the same boat. They're all trying different things to try and get their healthcare spending down. Some work, some don't. But nobody has solved this problem. And so I don't think that just spending smarter is going to get out of this. So we have a sustainability problem going forward.
And how does that manifest itself as we go further into the future?
Well, the problem gets bigger and bigger. Right now, the government of Ontario, for example, is spending more than 40% of its revenues on our healthcare system. So soon it will hit 50 if things keep going. And you can imagine at some point there's a ceiling. Not only is this, and it's probably not 100% because there's other things we want our governments to do, education, helping people in need. And so the problem gets more severe as time goes on.
So how do we solve it?
How do we solve it? Yeah. Well, there's a good news story here, right, which is that the system is getting a lot better, right? I don't think many of us would trade the healthcare system we have today for the one that we had in the 1970s, even though the one we had in the 70s was much cheaper. I mean, there's a lot of things we can do today that are really great things. We've invented NICUs, neonatal intensive care units, for babies who are born prematurely, and I don't think anybody would want to remove those from the system. So that's the good news story. I mean, the other side of it is that we're going to need to continue to find more money for this. And colleagues of mine and I at the University of Toronto have been thinking about this, and one of the things we're noticing across a lot of different countries is that countries are diversifying the revenue streams into the healthcare system. So if they're predominantly tax funded, they're looking for some other contributions from employers and workers in a public way, not necessarily a private way. If they're predominantly social insurance funded, so they get contributions from workers, they're looking for some tax money to go in, and this diversification will help a little bit. One of the things I'm thinking about is thinking about what we need as we move into that age where we're no longer going to work. All right? And you said the population's aging. It's aging slowly, and there'll be more of us who are old. And what are we going to need for sure? What do we know we're going to need today when we get there in old age? For sure we're going to need some money, and that's why we save for retirement. And we've known that for quite a while. But there's other things that we pretty much now know we're going to need. If you look at the population above age 70 right now, almost everybody takes prescription medication. Why? Because it keeps some of their chronic conditions in check. It helps them stay healthy. We know that if this trend continues, we'll all need prescription drugs when we're 70. We'll probably also need some help to take care of ourselves, either at home or in a home. And we can predict that too. As we live longer, we're going to become more fragile. We'll need some help. And so I'm trying to think about ways where we can pre-fund today to have that money available for us tomorrow and ease up the pressure on a yearly basis on the money.
Kind of like a CPP for your health, in a way.
CPP for your health. That's one way to think about it. Not for the whole system, but for parts where we know for sure we're going to need it, like drugs.